So good afternoon. My name is Dr. Millan, and along with Dr. Margaret Avila, we will do the next presentation entitled Infrastructure and Curriculum Integration of Key Concepts of Cultural Humility, Inclusion, Social Justice, and Equity to Address Diversity and Latino Hispanic Nursing Student Success. Objectives. The first one is to discuss the principles for integration of certain concepts that promote and support faculty and student diversity and Latino Hispanic nursing student success. 2, select and design inclusive activities that reflect diverse perspectives, students, and learners' needs. For the purpose of the discussion today, we can see that the definition diversity includes many aspects of humility, including all aspects of human differences, within which include socioeconomic status, race, ethnicity, language, nationality, sex, gender identity, sexual orientation, religion, geography, disability, and age. As educators, we can reflect on the past year. We must be honest with ourselves and say that now more than ever, all our students need an educational experience that's inclusive. And they need a place that creates a climate that fosters belonging, respect, and value for all and encourages engagement and connection throughout the institution and community. The concept of social justice is not new to nursing. We just have to reflect on these concepts as they can be controversial in our current environment of I Can't Breathe. Every environment, including nursing education, needs to reflect, especially as a Hispanic-serving institution, reflect how this affects our students. We need to recognize where our students come from, especially when designing nursing curriculums, that we need to be sensitive to and be ready to assess these things. We need to be able to manage overt racism safely and learn from it and educate others. In the same spirit, attaining health equity of the highest level of health for all people. We cannot make assumptions where our Hispanic students come from and or if they are prepared for the academic challenges. Many may be prepared, but others may not, as they may have attended schools where they were not fully prepared due to the inequities of their education. Once students are admitted, we need to assess for these inequalities to be able to recognize for readiness and skills for the challenge of an intense program like nursing. Nursing historically roots are implicit, founded in social mission. The American Nursing Association Code of Ethics urges nurses to confront wrongs, promote, protect, and advocate for all patients, communities, and urges nurses to confront biases, protect human rights, and reduce disparities. ANA further states that nursing must develop anti-racist practice, research, and education to begin to address racism. As we all know, that the lack of diversity among healthcare professions has significant consequences for access to healthcare services, health outcomes, and health equity for patients and our communities. In addition, NLN is asking that nurses and nurse educators integrate the social determinants of health into curriculum as part of the profession's commitment to advocacy, social justice, and health equity. So how do we start? As nursing educators and administrators at this point, we need to reflect on our mission of our nursing programs. We need to review, revise our mission, vision statements at least every 2 years to make sure that we're meeting Hispanic nursing students' needs. So we need to review what we do and who do we serve. And as a Hispanic-serving institution, you need to consider Hispanic nursing students that you serve. And more importantly, faculty need to be part of developing this mission and vision because, as we know, we faculty are the ones that need to apply it into the education environment. Concept, health equity, and social determinants. Nursing students are taught that skills such as empathy, perspective taking, emotional regulation, and a partnership of building with patients has a positive effect on patients' experience and outcome. So what we're trying to convey here is that the student practice is with their patients, and your practice as faculty is to the student. Practice what we preach. We need to practice what we preach. Faculty practice in academia area is focused on students and their students' needs.
As we continue with our exchange, we also want to point out that it's almost an oddity to be singing to the choir. Everything that we've shared is not new, but it's a restatement for a recommitment to what needs to take place. The following is shared for the purposes of reaffirming with you that there are certain approaches, tools, strategies that you are all familiar with and are highly recommended for the process of inclusion when focusing on Hispanic or Latino students. Many, if not all, may already be in place, and that's great. Then you are well ahead of the critical, innovative campaign needed to address the enhancement of diversity within your educational system, institution, and particularly within our nursing profession. We are faced as nursing educators to respond to the dynamic changes in healthcare systems. We have always historically focused on acute care settings, but we find ourselves needing to interweave healthcare delivery systems in communities with a focus on primary care. With the communities living longer, we are now looking more at long-term care, in-home care, hospice, and so forth. With increased access to healthcare through government-funded programs such as ACA, health literacy must be addressed to facilitate impacting health equity. Seeking innovative partnerships with service providers so that our students are exposed to various practice settings is truly a necessity. This experience is key in appreciating health dilemmas facing patients, their families, and the communities. And we can better serve our students in preparing this to anticipate their patients' health needs in various settings. Usually the largest and key factor in any healthcare system is the exposure to such settings is critical. To do this as faculty, we need to gain experience in such settings while becoming acquainted with potential partners in such delivery systems. Clearly, the professional development is imperative to develop each of us as nursing faculty. Expertise in these settings is required. And as faculty, we need the support in order to meet national recommendations as we prepare students for the future healthcare needs of communities and now very much in primary care. A key element to ensure the social mission of our profession is a core value of the nursing program. In the nursing program is to increase faculty diversity. The Future of Nursing report by the IOM recommended increasing the diversity to promote cultural relevant care. It is a challenge requiring faculty, administration, and human resources to collaborate on identifying strategies that will help to increase faculty diversity and create a safe work environment where diverse faculty can thrive. It is also critical that one of the major challenges for students of color entering healthcare professional schools include access to individuals who can be their role models and their mentors. Nurse educators can continue to lead the charge, preparing the next generation of nurses to possess the competencies that are critical in this changing dynamic environment. It is time to examine or re-examine the core purpose of nursing education so that nursing can truly impact societal health needs. We are familiar with the challenges of change. We teach change. We teach about being change agents. No matter how small or extensive it relates to, focusing on educational infrastructure, the emphasis on a continuous thread regarding barriers, among others, must be addressed in individual programs. The listing is definitely not at all inclusive, as you see here in what has been listed as some of the proposed barriers, but it is not all inclusive. Clearly, those who are participating in the change must have a buy-in. They must make it their own. There has to be the availability of preceptors. Sometimes we don't have the fortune of having it within our own systems, and we may have to look to each other in our sister institutions and in institutions even outside of our state in order to find out what has worked and what hasn't. Logistical change and coordinating clinical sites is an ongoing challenge. And if we change, when we start to change the settings and start adding settings that we want to make them proficient in, students will often fear that they're not learning all the skills required in the various settings. As noted earlier, not only in this presentation, but in a previous module, cultural humility is lifelong, and it is fundamental when we're looking at ethical foundation to our nursing profession. We've already noted that the code of ethics is central to accepting our responsibility to respect the dignity of every person, regardless of their unique characteristics. Nurse educators are clearly committed to ensuring nurse graduates develop cultural humility. It's amazing when we start looking at our curriculums that they're probably, you can count on one hand, if anything, the number of courses that we include in the curriculum that don't somehow either address, reflect, or include some aspect of culture. It can be not only in the clinical courses when we talk about relating to patients and communities, but even in our general ed courses. It is something that we believe is core to the ability to care for patients, families, and communities. And as educators, we find ourselves in this practice in particular, that we are the guardians, protectors, and innovators in the evolution of nurses doing their training as they prepare for current practice. Our focus is nursing students, and they are our practice recipients. All we teach students regarding cultural humility as nurse educators must provide an infrastructure within our programs that are safe environments to learn, be themselves, and respect their uniqueness as individuals. We need to do and prepare and be ready to deal with students very much like we ask our students to prepare and be ready to address the needs of patients, families, and communities. These concepts listed here to reinforce the critical issue of cultural humility are noted. The threading of the process throughout the curriculum can sometimes be a change, but we are also facing threads through curriculum for other topics and other issues as required by the Board of Registered Nursing. These examples of application are familiar to us and are only the beginning of the list that we currently are familiar with. Many of you could clearly add to what these two bullets begin to show us. Sharing any successes would clearly be the next stage for all of us to have in either a verbal or written dialogue. To have follow-up exchanges to this series of modules and these workshops, to share them in articles so that they can be published and we can all have access to learning from positive experiences, effective programs with strategies that have been very productive, is really the next step that we all need to consider. As already indicated, learning environments require a number of exchanges, social interactions. We've already discussed organizational cultures. We've referred to the infrastructures that need to be addressed, and the physical and virtual spaces that surround and shape participants' or students' experiences, perceptions, and learning. Many of you use various other platforms, online platforms, depending on your publishing sources that are available. Even include those, dialogue with those resources to see that their virtual simulation and their case studies provide the opportunities for all students to consider interacting, anticipating their interaction with patients, and also have time to include in the debriefing perhaps some of the issues that are related to cultural differences and potential biases of what was expected and what we received in reality from patients. This particular listed examples is what you currently use. Again, it's like singing to the choir. These items, these strategies, these processes are very much a part of how you practice as nurse educators. And clearly we have found that these teaching strategies need to be included, need to be varied, and need to have been very effective in the past, and I'm sure will continue. We ask only that we look at the thread of cultural humility, that we look at the thread of an unbiased, comfortable environment and case studies and learning situations that strengthen and reinforce those discussions that will facilitate all students being comfortable to have dialogues about similarities and differences in concepts that they're learning, in the application of care that we expect them to provide, and any difficulties or challenges they have. And we can do this by using all of these strategies that are listed here that we're very familiar with. One of the ones that we find that we would very much like to highlight now is reflective journaling. A number of articles and research has indicated that when used as a teaching strategy, it does help them to develop not only critical thinking skills, but also the ability to reflect on their practice. And it's been shown to lead to the development and enhancement of cultural humility. We each need to have an opportunity, both as nurse educators and among with our students, reflect on our own values and beliefs and cultural heritage. This begins to give us an environment in which we can share, hopefully in a comfortable environment and an open environment. Nurses can develop those awareness of how these qualities influence and promote cultural community humility, not only in healthcare, but as we dialogue among each other. We start to see each other, faculty to students, students to faculty, and among us, an appreciation of who we are as individuals and as nursing professionals. As previously noted, we must provide a system or infrastructure that includes a very holistic approach to teaching our students, and with it, providing mentoring and support, not only in the recruitment, which many of you have been very good at doing, in the selection process, which of course our numbers are going up. However, the retention and matriculation of all students, particularly the Hispanic Latino students, to the point of graduation. So the numbers surely have increased in the first two of recruitment and admission. What we haven't seen success in, carrying them through, matriculating and retaining them to the point of not only graduating, but eventually passing NCLEX. Nursing faculty are a critical component Along with administration and staff, we have a unique role to foster an empowering atmosphere for underrepresented students. These students who often desire a sense of belonging in higher education and seek caring mentors that will strive to help them achieve their educational success. All this to address the greatest need, improving graduation rates. Each of us in our institutions must serve students with creativity and flexibility, so much so that it allows faculty and staff working directly with students to make adjusting interventions based on frequent assessment and the needs of each individual current participant. Adjustments should be evidence-based, though, within reason, addressing student needs adequately, supporting successful retention and matriculation, and ultimately graduation, particularly for our Hispanic and Latinx students. With this, we very much are appreciative of your time and your attention. And we'd like to say thank you for this opportunity. And we'll be sharing with you a different perspective from that of the students.